On April 26th, the central Chinese city of Wuhan was declared free of COVID-19. The initial epicenter of what has become a global pandemic had reported more than 50,000 cases of the disease. Health officials claimed victory over China's outbreak after the last patients were discharged from hospital. When it comes to battling COVID-19, China has the most experience. It was the first country to fight the deadly new coronavirus that causes the disease. But as the domestic infection rate was slowly brought under control, China stepped up efforts to help other countries where the virus had spread. Since March, China has sent medical teams to 16 countries to help officials and health workers treat and contain COVID-19. According to its foreign ministry, China has sent medical supplies to more than 125 countries and regions, and 4 international organizations. Chinese medical experts have held more than 70 video conferences with their counterparts from more than 150 countries. And China has contributed a total of $50 million to the United Nations World Health Organization. The last $30 million came after US President Donald Trump announced that Washington would suspend funding to the international body. As the US looks inward to its own problematic response to the virus, China wants to take the lead in the global effort to fight and ultimately end the COVID-19 pandemic. But critics question its motives.
We strongly believe that the Chinese Communist Party did not report the outbreak of the new coronavirus in a timely fashion to the World Health Organization.
Some say China's offer of assistance to the international community is to make up for an initial cover-up by local officials in Wuhan in the early stages of the first major outbreak. Li Wenliang was one of the first doctors in the city to try to alert the public about a new mysterious pneumonia that was spreading. But he and 7 others who had written about the severity of the illness online were summoned by local police. They were forced to sign a letter promising to make no further disclosures about the disease. And Chinese state-run television accused the 8 of spreading what the government called rumors. Just over a month later, Dr. Li contracted COVID-19 and died from the disease at age 34. Jonathan Hillman from the Center of Strategic and International Studies in Washington told the South China Morning Post this is not something other countries are likely to let go.
Medical teams and supplies will be appreciated in the short term, but I don't expect anyone is going to forget the outbreak's origins. Many of these countries have been willing to temporarily overlook China's initial attempt to cover up the outbreak because they urgently need all the support they can get.
Health experts, officials from other governments, and even some Chinese citizens have questioned the numbers China has reported for its COVID-19 infections and deaths. Officially, mainland China has had just under 84,000 COVID-19 cases and about 4,600 deaths. Like many countries, China has struggled with how it classifies official cases. Many have accused Chinese health authorities of skewing the data. Critics point out that China has revised its definition of what classifies as a COVID-19 infection 8 times since the outbreak began in December 2019. A recent study by scientists in Hong Kong suggests that China's COVID-19 infection numbers would have been 4 times higher than what officials reported in February if they had used the most inclusive definition for a case from the start of the outbreak. The scientists suggest that had that been done, infections by mid-February could have numbered 232,000 instead of the 55,000 that was officially recorded. As China struggled to get a grip on the spread of the disease at the beginning, many around the world are looking back at what was done and asking, was it enough? The COVID-19 pandemic has pretty much halted the global economy. And observers say China may be worried that it is jeopardizing President Xi Jinping's ambitious Belt and Road Initiative, which aims to boost trade and infrastructure ties across Asia, Africa, and Europe. They point out that most of the countries China has sent medical teams to are partners in that initiative. Eliza Gambino, a doctoral student at the University of Edinburgh, has researched Africa's role in the Belt and Road Initiative. She told the Post that China helping nations to fight COVID-19 effectively protects Beijing's long-term interests on the continent.
Contributing to the containment of COVID-19 in vital Belt and Road countries also protects and secures Chinese companies' presence and Chinese investments more broadly.
Do you think that there should be some consequences if in the end, China was responsible for all of this?
Well, if they were knowingly responsible, certainly. If it was a mistake is a mistake. But if they were knowingly responsible, yeah, then there should be consequences.
World leaders, including US President Trump and German Chancellor Angela Merkel, have called on China for more transparency about the origins of COVID-19. The speculation that authorities are not being entirely truthful reinforces suspicions some in the West have about the Chinese government. A survey in March by the Pew Research Center, a US think tank, showed that 2/3 of Americans held an unfavorable view of China. It was the worst rating China has had since the poll began 15 years ago. The poll found that cyber attacks, the US trade deficit, military rivalry, and human rights violations are the issues Americans most associate with China. Gal Luft from the Washington-based think tank Institute for Analysis of Global Security told the Post that as the US gears up for a presidential election in November, Trump is unlikely to dial back on his anti-China rhetoric.
Trump is known for his tendency to shirk responsibility and shift the blame to others. In the face of the biggest crisis of his presidency, and as he gets closer to the elections, he's likely to openly put the blame on China and allow his deputies to do so even more explicitly.
Such tactics would continue to build American mistrust of China.
"抹黑、污名化，掩盖不了事实。栽赃、甩锅，赶不走病毒。团结合作才是唯一正道。我们奉劝美方停止政治操弄，做好自己的事儿，把精力更多放在如何尽快战胜病毒和提振经济上。"
China hasn't been taking the criticism lying down. Foreign Ministry spokespeople have continually defended their government in daily press briefings against allegations from the US and other countries.
我们奉劝澳大利亚方面放下意识形态偏见和政治操弄。新冠病毒的源头和传播途径是一个复杂的科学问题，应当交由科学家和医学专家去研究。任何非专业人士匆忙下结论，是极其不负责任的行为，对国际社会合作抗击疫情没有任何好处。
China has also sought to allay concerns about its motives for offering assistance.
中国在抗击疫情防控当中呢，有一些比较有效的做法和有益的经验，我们很乐意同其他国家分享，但是我们不会把它用作什么地缘政治的武器或者工具。
But China's leadership is very much aware of the road that lies ahead. In early April, President Xi Jinping said the country must get ready for unprecedented external adversity and challenges in the long run. A government advisor told the Post on condition of anonymity that Beijing is seeking advice from think tanks, academics, and others on how to deal with the international backlash over the COVID-19 outbreak. Overcoming global mistrust may be a bigger challenge for China right now than overcoming the disease itself.